Good morning and welcome to this edition of the Lynne Freeland Show. I tell you what, every week is an adventure. We've tried FaceTime. We have tried Skype. Well, guess what? We are doing Zoom this morning on the Lynne Freeland Show, but we're doing Zoom because the issues we need to talk about are that important, and I have an array of guests that I want to share in the conversation. So I'm just going to introduce the entire panel, and then you will understand why this is an important conversation. We have with us today from Pittsburgh City Council, the Reverend Ricky Burgess. From Allegheny County Council, we have DeWitt Walton. From UPMC, we have Dr. Tracey Conti. From, I feel like I want to make sure and I'm trying to do this. And oh, by the way, I'm at home while we're doing all this. State Representative Jake Wheatley. From Pittsburgh City Council, we have Daniel Lavelle. We have from the Forbes Fund, Fred Brown. And we have State Representative Ed Gainey. Welcome to you all. Thank you so much for doing this. I know that this poses quite a challenge, but each one of you brings something different to the conversation, so I appreciate it. And State Representative Wheatley, I'm going to start with you because collectively, with the exception of Dr. Conti and Mr. Brown, you all represent Pittsburgh's Black elected officials. And I know that you have been working on the issue of the novel coronavirus and the Black community in particular, and some of the concerns within our community. Jake, I'm going to start with you. Give me an idea. I know the concerns I hear. What are the concerns that the Black elected officials are trying to zero in on?
Well, I think, Lynn, first of all, thank you for having us on here. Thank you. I want to thank Fred and Dr. Conti for being our partners in this endeavor. But the reality of the situation is around the country, we were seeing when data was coming out, we were seeing that the communities of color were some of the most hardest hit communities through this pandemic. And it wasn't any surprise that the underlying issues that we suffer, many of us suffer from before the pandemic, was only exacerbating our community's defense system against this virus. And so what we wanted to do is to get in front of it here locally and to try to partner with our community health experts so that we can be on the front end of coming up with a strategy of not only expanding testing, but also how we figure out how we get our folk and who might be infected, how we make sure that we understand what's going on once they go back into those communities, because we know the testing right now is not sufficient enough to really let us understand how vast the problem might be in many of our neighborhoods. So that's why we wanted to work with many of the experts that we have in our community health field, like Dr. Conti and Fred. They had a collection of folk who were already looking at this issue when it first started to hit. And so with our work that we were doing to try to look at the foundational issues, the root causes that are impacting our neighborhoods, we thought it was a perfect time and a perfect fit for us to get in front during this crisis.
Indeed. And Fred, I mean, when Jake talks about partnerships, because this is a multi-pronged issue, especially as it deals with our community, it has to be a multi-pronged approach.
Well, certainly, I think when you think about resolving an issue such as this, it's not one single focal point. I mean, the issues that we're confronting and why there's a disproportionate impact in people's of communities of color has to do with a myriad of things, comorbidity issues that Dr. Conti can speak to. And so we were very excited to think about how can we address this issue at a much more systemic level and partner with the elected officials to really create a more cohesive response that supports the entire community so that it's not reactionary. It's really looking at how do we use this as a launching pad to think through what are the other issues we need to address concurrently to mitigate risk in these communities.
And Daniel, I'm going to try to get you and Ricky to weigh in this kind of collectively. or together, because when you look at your community, Daniel, look at your community, Ricky, I mean, we talk about, people talk about these frontline responders, but the realities are a lot of the frontline responders are coming from your districts. They're not necessarily the doctors and the nurses, but many of them are, you know, the bus drivers, the folks in the grocery store, the folks who depend on public transportation that are out there every day.
So you're absolutely correct when you say that. And that's part of the reason why across the country, you also see the Black community being hit so hard, because we are, in so many cases, a lot of the low wage scale workers. We are the individuals who are performing the jobs that are now, that historically we never deemed as essential, that all of a sudden we discover are indeed essential, which is also why we need to increase minimum wage, but that's a issue. But we are seeing that Black and brown people across this country that come out of districts like ours, like myself and Reverend Burgess's, they are essential to keeping this economy going. And that's part of the reason why they're also being hardest hit.
And I'm also concerned about what happens post-COVID, right? Our community, many of them have had sometimes seasonal jobs, and this has put them into severe crisis. Those who are working, many of them are working in hospitals, you know, and working not jobs. And then some people lost the jobs they have. And I'm concerned that post-COVID, that we don't put enough resources to make up. Our communities were already fragile. And so after COVID, I'm really concerned that the government entities won't put enough resources into lower and moderate income communities as they deserve.
Mm-hmm. And Dr. Conti, I mean, I think the other thing that has been a big issue for me is the fact that, you know, we've kind of zeroed in on, and we've talked a lot about the disparities within our community and the underlying health issues, but those aren't new. Those have existed in our community for a while. So how do we keep the attention there once everything gets back to some semblance of what people want to call normal?
Right. That's why I think it's so important. And first, thank you for having us on here, but to work with our elected officials as well as our community partners like the federally qualified health centers, working with the health department, working with the two systems, UPMC and AHN, to make sure that we are all keeping a focus on this. And while COVID is not the reason these disparities exist, I think it has highlighted the necessity for us to address these disparities.
Indeed. And you know, the challenge when I have all these guests is getting everybody in, but we're going to do that right after the commercial break. So stick around when the Lynne Hayes Freeland Show continues. It's a Zoom edition of the Lynne Hayes Freeland Show. We'll be right back.